now, so it's really nice to be able to share this work with you all today. I'm going to give some background and context to our health research work, and after that I will be handing over to Sky and Lucy from Better Decisions Together, who will talk you through more of the research findings. But I'll start with some background to Activity Alliance. So our vision is a future where all disabled people feel that they belong in sport and activity. And as an organisation, we work with disabled people, an alliance of committed partners. And then we lead the way in knowledge and evidence-led insight on disabled people in sport and activity. So that is who we are. If we go to the next slide, please, this is about why we're all here today. So this is a 1-hour webinar. So in this hour, we will be sharing some of the key research findings that we have from our recent report, which is on the healthcare professional supporting disabled people into physical activity. And as part of this, we will also hear from some of the projects which feature in our case studies that showcase this good practice of where things are going well across the country. And then towards the end of the webinar, we will look at exploring ideas for scaling up this good practice and where we're moving on from this research. So that's what we've got in the next hour. So if we go to the next slide, this is some recent relevant context, as NHS England has recently released their position statement on harnessing the benefits of physical activity. And we're sharing this position statement points here, and many of the points are quite relevant and align with some of the research findings that we have in our health research. So it's quite timely, so it's useful to share here today for some extra context, because it does outline that physical activity, as quoted here, is essential for health and well-being. And it does outline that it is especially important for people with health conditions, and also highlighting that they do not receive the support that they need to stay active. The next slide, please. This gives a bit more detail about the position statement and its relevance to our research. So we have here outlined that healthcare leaders, as it quote, need to be much more ambitious, and that the NHS will incorporate physical activity into wider plans for long-term conditions through 4 ways forward. And these are outlined here on the slide for you. So we have the first is empowering health and care professionals and equipping them with the skills and confidence to have the discussion about the importance of taking up physical activity of those with health conditions. The second is incorporating physical activity into clinical pathways. The third is supporting the NHS workforce by promoting physical activity both in work and outside of work. And then we have supporting innovation and evaluation with partners. And this does include increasing the collaboration between the NHS and the physical activity sector. So that's some of the relevant points on this position statement that really has additional context to our research. So if we go to the next slide, please, this is the context and background specifically for our health research here today. So as an organisation, we were aware that healthcare professionals are known to have a role in positively impacting disabled people's health and well-being through promoting physical activity. So for instance, our annual disability and activity survey has consistently shown over the years that disabled people seek advice and guidance from healthcare professionals, and that they would like more advice and guidance from healthcare professionals in relation to physical activity. But we never knew any more really than this surface level data and information, and we wanted to understand a little bit more what disabled people's experiences are in this area and what work needs to be done in this area. So we commissioned Better Decisions Together to explore what is the role of healthcare professionals in supporting disabled people into physical activity. The next slide, please. This will outline our research journey. So like I said, this was a research project that started just over 2 years ago now, and it took a multi-phase approach. So the first phase was very much an internal piece of research, and this focused upon understanding the landscape. It took an exploratory approach to exploring the data, the information and the experiences in this area and what directions our research could take. So this involved a literature review, So this was a rapid evidence assessment, which looked at the data, the information, the research that exists in this area. And then with primary research of interviews and focus groups with disabled people about their experiences and their perceptions and what they're generally looking at it from many different perspectives in relation to healthcare, advice, guidance, physical activities. So really wanting to get an understanding of what's happening in this area. And like I said, this was very much an internal piece of research. So we didn't publish the research report from here, but it was used internally and it was used for our own discussion, our own thinking in this area, directing our work, and also directing where we're going with this research moving forward. And we did identify the need for an interim phase, which occurred at the beginning of last year. And this had two parts to it. The first was a co-created research charter. Now, this was co-created between Activity Alliance and disabled people. So it very much took a lived experience-based approach to developing a research charter outlining how we work with disabled people across many different areas of our research and our insight project. And then the second part of this interim phase was a stakeholder engagement workshop, which brought together stakeholders, various organisations in similar areas of disability, health, physical activity, sport. And we did share some of the findings from phase one here. And we also discussed other research areas, other work happening in this area, just to, again, get more of an understanding of the landscape and look at where we could have most impact and where we could have our research focus for phase two. And this led to phase two, which occurred throughout the rest of last year. And this was the research that we're sharing here with you today. And this very much took an approach of looking at good practice, where things are going well, and having a case study-based approach to how we can learn from this good practice. And this involved more desktop research, interviews and focus groups. So that was with the case studies, so any of the deliverers, the initiatives and health, physical activity, and also looking at disabled people's experiences, but this time focusing more on their good positive experiences of support from healthcare professionals into being more physically active. So that's the journey that we went on to get here today for the health research that we're sharing with you. I'm now going to hand over to Sky and Lucy from Best Decisions Together, who will talk you through some of the research findings. So over to you both.
Thank you very much, Molly. Welcome, everyone. I'm Lucy Nichols, and I'm joining you today from Taunton in sunny Somerset. I'm also joined by my colleague, Sky McCall, who'll be sharing some of our research findings later. Little wave there, Sky, thanks. And Sky's joining us from Kent. So we work together a lot virtually, obviously, because we're on different sides of the country. We've got the south of England pretty much covered. So if, you know, Sky's there on the East Coast, and they're on the West Coast. So if you need us to spot an Armada or anything, then just let us know. So yes, we're for Better Decisions Together. Next slide, please. And Better Decisions Together, we are a collaborative of about 10 freelance researchers. We're very small, and we work together to carry out research which is lived experience led and engagement and involvement. We work on things like strategies, and we're very passionate about building a more inclusive society through both workplaces and services. And that's what we do. We've been working with Activity Alliance for a couple of years now on some of these research topics, which is something that we, as I say, we're really passionate about this work, and it's been a really fascinating journey. So I do hope that you get a lot out of what we're going to be talking about today. So next slide, please. So yes, this project, specifically, we wanted to really make it very practical. We didn't want this to be another research project where we just had some theoretical findings and we knew more, but we couldn't really take this forward in any practical ways. So as Molly said, we wanted to see where it's working well across the country, where people, healthcare professionals, are referring disabled people into becoming more physically active, where that's working well. So we wanted to pull that out through some good practice case studies. So next slide, please. So we had a sort of long list of over 40 potential projects and approaches, and we pulled out 6 examples of good practice in local areas where we did a deep dive into those particular projects so that we could find out more and pull out some themes. So I won't talk about all of them in detail, but here they are. So access to exercise and well-being. We will be hearing from Ruth very shortly, explaining a little more about that. One of them was a health improvement practitioner in a community stroke team. So that's where there's a specific role in that community stroke team for healthcare professionals to refer into that role and for that person to be a sort of community connector. Move to include from Somerset. We'll be talking to Carly from Somerset as well about that one. The Parkinson's disease exercise group from Greater Manchester. This is a sort of 8-week program for newly diagnosed people with Parkinson's disease, getting them into activity, and a nice model of prescribing activity as well, well embedded into a clinical pathway, really nice. Super mashup at the Manchester Children's Hospital. This project is a really nice annual day where children with spina bifida are encouraged to come along with their families, really inclusive annual project led by and encouraged by sports people, but also clinicians within the Manchester Children's Hospital. A really lovely example. So please do make sure that you have a look through some of these examples and have a look at this report as well. And the final one was the Middlesbrough Power Chair Football Club, where there's a multidisciplinary team within the muscular team in Middlesbrough. They work really closely with the Middlesbrough Power Chair Football Club. Some really good relationships developed there, and so people are sort of referred in. Really nice. So, as I said, we wanted to make this really practical, and all of these case studies take a very different approach. So we tried to get 6 case studies that showed nice perspectives. Some of them are around integrating mainstream or non-disabled sports, kind of upskilling those to be more inclusive. And some of them are around specialist projects. And we're going to hear from one of those now. So I'm going to hand over to Ruth from who's the project manager for exercise and health, access to exercise and well-being. Thank you very much, Ruth. Over to you.
Thanks for that, Lucy. Yeah, we refer to it as A to EW, but it's important that it's spelt out in full. I'm Ruth. I am actually the project manager for the Neurotherapy Centre who lead on this project. I do also work for the MS Society around stakeholder engagement. And just to be clear, because it was a little bit different on the previous slide, this is a Cheshire and Merseyside project, and that was a very deliberate decision to develop work across Cheshire and Merseyside because that is the integrated care board footprint. I think Molly mentioned about the importance of healthcare professionals being linked into projects, and we wanted to make sure that it had kind of reach across that integrated care board footprint in Cheshire and Mersey. So that's me. Could we move on to the next slide? That's great. So the reason why I've got comments from participants to start off with is because this project, and I mentioned this was formerly the Access to Exercise project that was Sport England funded previously. It's now Reaching Communities funded. That we started this work as a result of talking to people about what they wanted and the difficulties they had in terms of accessing leisure services. So a very specific partnership was set up with Brio Leisure as part of the Access to Exercise project. And you've got the quote there. A lot of people were talking about the fact that they were quite reluctant to access mainstream gyms, and we really wanted to improve that access through a number of interventions, but also offering the Neurotherapy Centre as an option for people in terms of the work that goes on there. And if I could have the next slide, then I can explain what's on offer. That's great. So the project works across 3 venues. So that is the Neurotherapy Centre and then Greenbank Sports Academy in Merseyside or in Liverpool, and the Brain Charity also in Liverpool, but they do have reach out across the rest of Merseyside as well. And the Neurotherapy Centre and Greenbank Sports Academy and the Brain Charity have been established for over 30 years. So it was a really good way to bring that partnership work together around this access to exercise and wellbeing. You can see some of the activities that are available, and I'm not going to go through all of them. You won't be surprised to hear that the digital classes started up during COVID, because it was the response of the project to that period of time. And it was a really important part of maintaining movement and activity for those individuals who stayed in contact with the project. And what is interesting is, and I will mention the evaluation, but the evaluation showed that during the course of COVID, people's wellbeing scores slightly went up who remained in contact with the project. So that was a really, and they maintained their activity levels as well. So that was a really positive outcome from having that on offer. I think those conversations were really, really important to influencing what's available. And if I'm honest, the number of activities is growing. I mentioned Greenbank Sports Academy, and they offer quite a good link into competitive sports for people who may want to take up that opportunity. And some people, when we talked to them, did really see that as important. The other things that we're looking to add at the moment are arts and crafts, because that's become really popular, and there is a very set time for people to access that, both at the Neurotherapy Centre now and at the Brain Charity. And that links into the wellbeing offer, which became more evident that it needed to be part of the project during the course of COVID. And as a result of that, there is now a group work course as well as access to counselling that links into people's wellbeing. And that's about enabling people to address those issues so that they can make use of those activity and exercise opportunities. If we could move on to the next slide, I'm going to mention, this is possibly one of the things that is important to the project, but is only quite a small part of the project in reality, although it is being independently evaluated by Sheffield Hallam University. And really, the FES cycle is a functional electrical stimulation bike that people can use whether they're mobile or using a wheelchair, and it really enables people to improve muscle tone. It has mainly been used for spinal injury, but actually there is growing evidence around the use of it for people living with neurological conditions as well. And certainly you can see the huge benefits for that individual on the case study there. And I think it's probably worth saying that in addition to that, people have talked about being able to use more muscles than they had done before. There's one person with a condition called CMT who has talked about the fact that they had no sensation in their lower legs previously, and now are beginning to get sensation after only 3 sessions on the bike. And they describe that as breathtaking in terms of the impact on their life, but also on their balance and opportunities to move. And then somebody with functional neurological disorder has used the bike as well, and really sees it as something that has enabled them to not have to use the wheelchair that they were using and the walking aids over time, in terms of addressing weakness that they had down one side. And I guess this kind of leads into the reason for the project is really about improving access to opportunities that people can take up, not just in the Neurotherapy Centre, but in terms of that link with Brio Leisure as well, so that they can access community resources that maybe were difficult for them to access, or they weren't very confident about accessing them. So that support is there really to take part in other community activities. If I could have the next slide, please.
Just one more minute, please, Ruth.
Yeah, that's fine. So you've got the information about the evaluation there. Happy to, give any further information. We can circulate the report. And the final slide. We have also developed a Get Active toolkit, which was around working with partners to deliver this project. And it's much more the story of how we develop the work. So it's useful to have a look if you work in a number of different sectors, whether that be leisure or healthcare, and how we develop the kind of referral processes as well. Thanks, Lucy.
Thank you very much, Ruth. Thank you. That's fantastic. I know we're kind of galloping through all of this information today, but we are trying to cram it into an hour. So please do, try and absorb this as well and have a look afterwards at some of those videos as well as the report. So next slide, please. So Ruth has really illustrated nicely there some of these 6 key features of success. And if this for me is the kind of most important slide almost in this presentation, or this is the key information that I would love you to take away. And if you're thinking about planning this kind of work or working in this kind of space, setting something up or improving things in your local area, these are the 6 key features of success that I would really like you to think about. So the first one there is cross-sector collaboration. And I know you may be thinking, well, that's really obvious, but that really came across very strongly. It's not just a practical thing. It's about developing partnerships, developing relationships. And a key thing that we came across was that early buy-in is needed. A lot of preparation needs to be done early on. You can't just suddenly decide you want this to be amazing in your local area. You're going to set it up and it's going to look like this. It needs to start very early building those relationships. Referral mechanisms are also a really key part of it, and ensuring that that is discussed and set up very early, thinking about that governance. We know that referral between NHS services, social care services, and the voluntary sector is a continual sticky issue. Information sharing is always a nightmare, but it's something that has to come front and center when we're thinking about these kind of projects. The next thing is lived experience leadership. Again, that came across very strongly. Steering groups of people who will be using services, things like that, using disability consultants, even having disability consultants leading the work. Those were features that appeared in some of these, in almost all of these case studies. Third is a commitment to inclusion. So that's really just this understanding that sport and physical activity is for everyone, and that nobody should be excluded from sport and physical activity, and working from that basis. The case study that you're going to hear very shortly from Carly is a lovely illustration of this as well. The fourth element is community creation and mental well-being. And I think in some ways, this is a real feature of success, but it's not necessarily built in from the beginning. So by that, I mean, it's not something that people sit down and think, right, how can we get people to create communities of peers, and how can we improve their mental well-being? But in many ways, this was a side effect of that work. It was a kind of additional added value of the work, of that kind of social values, that people developed friendships and relationships with their peers who were also engaging in this physical activity. And all of that helped contribute to their mental well-being. Again, Ruth really covered that nicely, thinking about the kind of conscious consideration of counselling and that need to meet people's mental well-being needs within the project. Personalization and staying in touch. So personalization, again, person-centered care, we say it a lot, but what does it mean in this context? It's very much about making sure that you listen to the person in front of you, making sure that you plan something that is going to work for them in terms of physical activity. Joy came across as quite a strong theme in personalization. So finding out what causes, what makes someone joyful, what they enjoy around sport and physical activity. That's something that's very personal. And also timing. So making sure that when we connect with people, it's at a place where they are receptive to wanting to be more physically active, even though they might not have articulated that themselves, but doing that to kind of make sure that it's the right time for them. And finally, upskilling through education, awareness and training. And that applies for both healthcare professionals and for the sports and physical activity staff that we're working with as well. Making sure that everyone is kind of upskilled and there's that kind of mutual improvement across everyone involved. Key challenges then, next slide, please. So very briefly, I think it's worth understanding the key challenges as well if you are going to be thinking about setting up something in your local area or championing it, because you need to understand what are likely to be the barriers that you're facing. So non-responsiveness of key stakeholders, that'll be no surprise. We know that we do work in silos a lot of the time, and this sometimes just feels like working together is going to be in the too hard basket, as it were. It's just very difficult. Sometimes it was also the case that people were very enthusiastic to start with, but it didn't always, that wasn't enough to take it through. So something around building those relationships is key to that. There was a challenge of having quite small scale hyperlocal projects, and that kind of ties in with the next one, which is resource constraints. So we've got a lot of pilots that we came across in our long list, and those pilots are often funded because it's fun and sexy to fund a pilot project, but actually embedding that as a long-term project is a harder thing to do, and funders know that and projects know that. So often we were relying on voluntary staff and voluntary capacity, which isn't enough to push this through. Another challenge is the cultural resistance to system integration. Again, it's about us partly working in silos, but also it's very complex to integrate some of these things. For example, as I mentioned before, around referrals, that can be really hard. The non-disabled sector lacking readiness, and again, that's something that can be addressed with that upskilling and training. But it's also worth thinking about the sports and physical activity does have quite a high turnover of staff, unlike the statutory sector. So making sure that people are continually trained and that they are then staying in those roles with that training can be a challenge. Sourcing the right training is obviously another key issue, and alongside that, intersectional inclusion. Obviously, we're just kind of looking through the lens of disability inclusion, but people were quite conscious in the projects that they weren't reaching all segments of society and communities through the work. Next slide, please. And we were going to go over now to the lovely Carly, who will be talking to us about the project that's going on in my neighbourhood of Somerset. Thank you, Carly.
Thank you, Lucy. Yes, my name is Carly Ridgewell, and I'm the Disability Projects Lead at Somerset Activity and Sports Partnership. And I'm here today to talk to you about our Move to Include programme. Of course, as an active partnership, one of our kind of main motivations is to look at the opportunities and choice for people to be more physically active and reap the benefits of being physically active. But this project in particular was certainly accelerated by the employment of our health and wellbeing coaches. Some of you may know our health and wellbeing coaches spend certainly the majority of their time within doctor's surgeries, and they offer an alternative appointment to GPs with regards to patients coming in and being able to talk about their health and wellbeing needs. And as part of that appointment, health and wellbeing coaches will look at what is available within their local opportunity and how they can access movement, physical activity and sport to improve their physical wellbeing and mental wellbeing. And what we were finding is within appointments for adults with a disability, the opportunity to signpost into their local community felt really limited, either because there was a lack of awareness as to what was available, but also a lack of confidence around knowing which clubs and which kind of opportunities were appropriate and inclusive with regards to welcoming some of these patients. So they had a chat with us within the disability team around trying to kind of expand their knowledge, but certainly there was a gap identified around the amount of opportunities that sat outside of discrete provision. And whilst discrete provision certainly has a purpose, what we don't want to do is signpost people into disability provision because they have a disability and not give them the choice, the option. And as Lucy said, just explore actually what do people want to do? What are their interests? What do they love? And how can we help facilitate that? So the Move to Include programme is looking at how we can support adults with a disability into their local community provision. As I mentioned, one of the benefits of this is providing more choice and more variety for the people that we're working with. But also what we were looking at is one of the things that we know can be an issue is transition, and signposting alone isn't the answer. So whilst we were kind of looking at what might be available, we know we needed to support the transition into some of these opportunities. So Move to Include is a program where we have a connector in post. Her name is Zoe, and health and wellbeing coaches can refer patients, but certainly we have self-referrals as well into Move to Include, where they can nominate themselves into the program. Zoe will pick up that nomination and we'll do an initial meet with an individual to find out a bit more about them and what their motivations are with regards to wanting to be more physically active. Now, some of those motivations are certainly linked to kind of physical well-being, and we know there are correlations between certain disability types and conditions, you know, such as learning disabilities, and that kind of correlation to obesity and other health conditions. But actually, some of this was around mental well-being as well, and wanting to feel less socially isolated, wanting to build their friendship groups and just feeling like they can access their local community. So once we found out their motivations, we'd also find out what sort of activities they might want to do. And after that initial meet, Zoe would go away and look at different opportunities in the local area. To support with that transition, Zoe would then look to attend some of those sessions with that individual to help build their confidence. And we know sometimes the hardest thing can be getting through the door of a new setting, especially if we're feeling a lack of confidence. And as those kind of sessions continue, Zoe will look to step back and will transition that person into the community setting and make sure that they've built the relationships and the confidence with that new setting before we take a step back. Depending on the setting and the community provision, some organisations have quite good experience with working with people with disabilities or additional barriers to participation, and will already thought about some of the reasonable adjustments they can make and how they might go about that with the individual. Other organisations and community groups have much less experience. So as well as the connector supporting the individual, the connector is there to work with the community group. And that might be helping them to recognise some of the reasonable adjustments that can be made. It could be signposting them to training so that they build their confidence around delivering to different groups of people. And certainly Zoe can be that point of contact for the club once that transition period has finished as well. So it's not just done and off we go, but there's a relationship and a contact they've got moving forward.
One more minute, please, Carly.
Thank you. And what we do with the individual is we check in every 3, 6, 9, and 12 months after that initial transition into community clubs, just to check how things are going. You know, is it still working? Is it not? Are they maybe looking for something different? Or are they really happy and settled? And hopefully that we hope that to be the case. We have had some great successes with signposting some of our nominees into local provision, including health walks, social badminton, local gyms, swimming, cricket, and walking sports. But certainly one of the challenges we're finding is financial constraints for people, because community sports clubs especially have, you know, fees that people have to pay to be part of the club. So that's one of our challenges that we're exploring at the moment. Either how can we access funding or conversations we can have with the club around maybe subsidising some of those costs. Moving forward, we're looking to branch into other areas. We've piloted this in Bridgewater, and now we're looking to kind of build that offer across Somerset.
Thank you very much, Carly.
Thank
you for sharing that. That's fantastic. It's a great project. Okay, so I'm going to hand over to my colleague Sky now. We had a look at all these projects and we came up with these key features, but we really wanted to test that with a group of disabled people to get the understanding from 360 degrees really about what those key elements are of successful support. So I'm going to pass over to Sky to talk us through some of that.
Thank you, Lucy and Carly. It was really interesting to hear about your work there. Moving on now to disabled people's experiences of positive support. As Lucy alluded to, we held a couple of focus groups, and while those didn't form part of the original method, we felt they'd provide a valuable opportunity to check the emerging findings from the case studies. So you'll hear some similar things now as to what Lucy spoke about earlier, but hopefully what that's going to do is really reinforce these concepts in your mind. So next slide, please. So just looking now at the key features of successful support among the disabled participants that we spoke to. So mirroring those insights from the case studies, participants responded to personalized support that reflects the clinician's understanding of their specific conditions. And that meant focusing on what activities would be enjoyable and achievable for them specifically. Sitting down together to develop a shared understanding of their condition, needs, and interests, and creating a plan that would address that. People were also more inclined to act on support from trusted healthcare professionals who demonstrated clinical knowledge of their condition, with whom they shared a long-standing relationship built on common ground, like a shared cultural background or love of the same sports team. Then also a multidisciplinary approach, so consistent positive messaging and encouragement from all professionals along the healthcare pathway was a common theme. This helped to address participants' doubts about their ability to progress in their physical activity journey. Next slide, please. So the next three features of successful support. Firstly, starting with small, manageable routines and a gradual approach was important for individuals to build movement and strength without feeling overwhelmed. That role of community connector was key to many participants' positive experiences, as we found that in the focus groups, people were largely unaware of what local services or activities were available until they were suggested by their healthcare professionals. Finally, timing, something Lucy spoke about a little bit earlier. Just from the disabled person's point of view, that timing was crucial for effective support, as they needed to have the capacity to focus on their well-being through physical activity. For some, that timing came after an adjustment period following an acquired impairment or diagnosis, when they were ready to receive help, but before their physical or mental health declined. For others, it was when they felt their well-being was at risk of decline. And this suggests that support should be offered proactively at a point where individuals might feel mentally and emotionally prepared to engage with it. Next slide, please. We have a few types of activities that were highlighted and that participants were supported to do. Generally, these were exercises at home on their own, or more often classes or organized groups that were mostly in their local area, but sometimes at home through virtual sessions. So we sort of have a grid there with two key axes, where activities were either alone or in a group, and either at home or out of the home. Moving on then, we have our top tips for change makers. Ultimately, we took the learning from the case studies, focus groups, and reflections on earlier phases to create some top tips for those looking to affect change in the sector. The first of those was 5 ideas for healthcare professionals to more effectively support disabled people into physical activity. Again, reflecting some of those key points from earlier, engaging at the right time, allowing that time to process change, but starting those conversations before the person starts to experience a decline in well-being. Building relationships through human connection, exploring your shared cultural background, love of sport, or something else. And being a community connector by exploring and experiencing local activities yourself so you can connect people to things that are accessible and suitable for them. Then showing that you understand the person's condition and their specific circumstances. Share the positive impacts that physical activity can have in their situation and examples of how it helped others with similar diagnoses or impairments. Work with the person to build a personalized plan, find out what they enjoy, and direct them to relevant activities as part of that manageable plan. And be sure to follow up with continued advice and encouragement. Activity Alliance turned these top tips into a guidance resource for healthcare professionals, which I believe you can expect to see released soon as part of the publication of this research. Moving on, please. There we go. We also created a checklist of good practice to help integrated care systems and partners at this level to measure and understand what good looks like. I'm just going to go through a few examples, but you can find the full list in the report, the research report, as well as in some supplementary materials. So a few examples of these good practice principles. Firstly, governance structures are in place for collaborative working between healthcare, physical activity, and the VCSE sectors. There is an agreed shared vision for increasing physical activity in the system, which explicitly includes disabled people. There are easy system-wide referral mechanisms for physical activity and information sharing mechanisms between partners, as well as physical activity being embedded into clinical pathways and being prescribed as part of rehabilitation. Next slide, please. So as I mentioned, the checklist is available in various places, and a similar version is available in the guidance leaflet for wider healthcare systems that Activity Alliance has created coming out of this research. Again, that should be published alongside the guidance for healthcare professionals and the reports that are coming out. And then I believe it's back to you, Lucy.
Yes, so thank you very much, Guy. That's fantastic. And I really can't emphasize enough the value of those two resources that Activity Alliance have put together on the back of this research. So the top tips for healthcare professionals and the checklist for integrated care systems. They're really short, they're really punchy, but they absolutely distill the practical findings that have come forward as a result of this research. So I really do commend them to you. Next slide, please. So just in terms of scaling up, I think, this is largely covered by those things, that checklist and the top tips, but working in collaborative partnerships across healthcare, voluntary sector, and sports and physical activity partnerships, that's really essential for scaling up this kind of work. We've already mentioned that a lot of this work is quite small, it is local, but it is absolutely possible to scale this up. Those local place-based partnerships, so that local people can benefit from professionals who have knowledge of local community provision. That's really important. Referral systems, as we've already mentioned. Next slide, please. Embedding physical activity champions. Some great examples of that already mentioned in our case studies and from our speakers today. And scaling up of funding represents a challenge. That's the understatement of the entire presentation. But it is essential to move on beyond pilot projects, to thinking about how the local systems can be committed to commissioning this work, to embedding it in clinical pathways, and to making sure that we are meeting the requirements of NHS England in their position statement, as an example. Next slide, please. And finally, ideas for national action. Just if we're thinking about raising awareness of this on a national scale, on the national stage, working with respected key players in the sector is really important. And by that, I mean some of the large national charities, for example, who can really help us raise the profile of this work. Establishing a standardized training framework for key professionals would be great if we can do that. Centralized support hubs and peer networks was a suggestion from the disabled people that we spoke to as something that would be beneficial. And continuing to raise awareness of the importance of a diverse workforce. I can't emphasize this enough. Activity Alliance have done a lot of research into the workforce gap when we're thinking about disabled employees in the sports and physical activity workforce. We absolutely have to have a diverse workforce if we are going to meet the needs and understand the needs of the diverse people that we serve. And that is a really key element that comes out of this research as well. So final slide, please. Overall, this is a summary sentence, really, which we've put in our research report. Our research shows that there are reasons to be positive about the tremendous potential within the current landscape to scale up how disabled people are supported into physical activity. Positive collaborative change is possible, and not only it's possible, but it aligns really well with current healthcare priorities. And as Molly said at the beginning, that position statement from NHS England absolutely aligns to the work and to the findings that we've carried out in this project. So thank you very much for listening today. I'm going to hand over now to Molly to wrap up this webinar. Many thanks. Please do get in contact with us and with Activity Alliance if you want to discuss any of this further. We're really happy to talk about it, something we're very passionate about. Thank you very much, Molly. Molly, I think you're on mute.
Apologies that I was on mute, I didn't realise. I was just saying thank you to Lucy and Guy for presenting that research finding for us. I really hope that you found it useful and that some of the points resonated and you're able to take this research away in a very practical way. And I think the next slide, I believe, does has a list of the resources and reports that are available on our website. So we have quite a lot of document to share from this research, in the sense that we have our full research report is available on the website. We have the good practice case studies as well, and we have an executive summary of the full report. And this is available as a PDF document, accessible PDF, and it's also available in accessible formats of easy read and BSL. So they're the research reports. And then we have other supporting documents. So we've got the guidance document that was highlighted there. We have the guidance for healthcare professionals. We have guidance for healthcare systems. So both those guidance documents are available on the website. And then we also have the research charter that was created in the interim phase. So all of those are available on the website for people to view. So please do go and have a look alongside this webinar. And I believe that's the final point from the research. I think the final point from me is to say that I think my colleague is going to share a feedback survey from today's webinar, and she's going to share in the chat. If you could complete the survey about just your feedback on how you found the webinar, we really appreciate that. It just helps us understand what's useful and how we could improve our webinar in the future. The link will also be sent out separately as well, if people prefer that, it's more accessible for you to access the link on the email. That will be available, so please do complete. That's only 6 questions, quite a nice short survey for you. So yeah, I believe that it comes to the end of our webinar. Just to say thank you for watching, and thank you for colleagues speaking today and supporting in the background. So thanks very much. I hope it was useful.
If I could just suggest that maybe we don't close the webinar immediately, because I think there's a few chats happening. People might just be typing furiously, so maybe just give it a minute or two.
Yeah, that's fine. I'll keep it open.